All right, we're going to talk about metformin. Metformin is also known as glucophage, and this video is to explain why this is the first choice for physicians to prescribe newly diagnosed type 2 diabetics. Don't forget to like and subscribe and share this medical content if you would like more. It helps me grow my channel. So how does metformin act? It reduces the sugar that your liver produces. It also helps improve the sensitivity and efficacy of the insulin at your tissues, thereby allowing your tissues, your muscles, to store more glucose from the bloodstream, making your blood sugars less. And lastly, it helps your intestines absorb less sugar from the food. Unlike other medications, metformin does not directly stimulate the pancreas to produce more insulin. Thereby, it prevents low blood sugars, what we call hypoglycemia. On average, the hemoglobin A1C can drop by anywhere from 1 to 2% over the course of 3 months. Also, another plus, it does not lead to weight gain. In a few cases, there was some modest weight loss, but it's not primarily designed for weight loss. If you're overweight or you have heart issues, there has been some benefit noted in further complications of heart disease, as was seen in the UKPDS study group. Now, doctors may start you on a low dose. It comes in 2 formulations, extended release and immediate release. I've seen starting doses of anywhere from 250 to 500 milligrams per day, and usually you'll be graduated up to either 2,000 milligrams per day or even 2,500, which is more rare. Now let's talk about the side effects. Because metformin is acting on your gut to absorb less sugar from the food, there are expected GI side effects of nausea, a little bit of cramping, some mild vomiting, and just an overall abdominal upset sort of symptom-like presentation. In order to minimize these side effects, some patients will take the metformin with food rather than an empty stomach. These particular side effects are expected to go away. However, if they persist, consult with your physician. Other side effects include lactic acidosis, which is a highly fatal condition, but incredibly rare. I have yet to see this in clinical practice. What happens is that metformin leads to an excess production of lactic acid in the blood. This can mimic sepsis or other conditions in which a lot of acid is produced. The medication is usually stopped in cases like that. Another problem that can happen to a large number of people that take metformin over years is vitamin B12 deficiency. Because metformin acts on your gut, there is a decrease in vitamin B12 absorption. Most people will not experience this, but if there are any neurologic findings such as numbness, tingling in the hands, then vitamin B12 needs to be looked at. It's an easy blood test your doctor can check. For patients who are on metformin, they do need to have their kidney tests checked periodically, and they also need to be reassessed for other measures of diabetic maintenance, such as lifestyle behaviors of exercise. Don't forget the 150 minutes per week, and then consuming a diet that's healthy with reduced processed foods and good numbers of fruits and vegetables. Metformin has been known to be safe, affordable, and effective. It is our first choice to prescribe a newly diagnosed diabetic. Follow me for more content. This helps me grow my channel. If you like, share with someone that you think may find it helpful. Until next time.